Hello, everyone. We'll just wait a few more seconds for a few more people to join us. Okay, I think we'll get going. Good afternoon, everyone. My name is Kieran Sampson, and I'll be hosting this webinar on behalf of the Eracy team today. So thank you for joining us. Today we're meeting on unceded sovereign lands of Aboriginal people. We'd like to acknowledge the traditional custodians and their enduring connections to its lands, waters and skies. I pay my respects to elders past and present and extend that respect to all the Aboriginal and Torres Strait Islander peoples that might be joining us today. In solidarity, Eracy supports the Uluru Statement from the Heart and the need for truth-telling about the history and impact of colonisation. We treasure the rich and diverse cultures and customs of First Nations people, their knowledge holders, leaders and partners in creating the conditions for all our children to thrive. Please feel free to acknowledge the country you're joining us from today in the chat. So, Eracy hosts webinars to share information and promote discussion across a range of topics. We welcome the opportunity to highlight the research of others and centre the voices of those with lived experience. Through these webinars, we seek to grow professional capacity and knowledge right across the sector. During this webinar, your mics and cameras will remain off for the session. You'll be able to add questions for our panellists via the Q&A in your control panel at the top of the Teams webinar window, and you can post questions at any time. Just a reminder that the webinar is being recorded and it'll be made available on the Eracy website and the YouTube channel. So, we all have a right to be heard and to shape decisions that affect us. And research evidence is important in guiding appropriate policy and practice. However, research often excludes or fails to appropriately accommodate children with disability and their families. So embedding the voices of children and families requires researchers to meet them where they're at, get creative and be child and family centric. That is, to put families in focus. So, Families in Focus is a unique approach to conducting research. To meet families where they're at, they organised a 2-day interactive research event to coincide with the 2023 Children's Week, with the aim to understand the educational, health and social support experiences, needs and research priorities of children with disability and their families. And joining us today to share more information about this unique approach is Associate Professor Jasneek Chawla and Letitia Coles. Associate Professor Jasneek Chawla is a paediatric respiratory and sleep medicine specialist at Queensland Children's Hospital in Brisbane, and Jas leads this Kids Sleep Research Group at the Child Health Research Centre at the University of Queensland. Her research interests include sleep in children with complex disability, and she's currently leading multi-centre MRFF, or government-funded study, focused on improving the diagnosis and management of sleep disorders in children with neurodisability. Jas is a strong advocate for children with disability and chronic illness and collaborates widely with many consumer representative organisations and individuals with lived experience through her research. And also presenting today is Letitia Coles. Letitia is a fellow and an applied mixed methods sociologist at the Queensland Brain Institute at the University of Queensland. Her research spans the fields of sociology, psychology, education and health. She has expertise in research focusing on the care environments in which children learn and develop. Letitia is interested in understanding the experiences of children with disability and their families and caregivers in order to direct research focus to areas of most need. Letitia has extensive experience managing large-scale research projects, working in multidisciplinary research groups and in research translation. So I'm really looking forward to hearing what they got up to, and it sounds like they got up to some unique ways to draw out the sort of information that they wanted to find from young children, which is often a challenge. So please join me in welcoming the Families in Focus team today. Over to you.
Hey, thank you so much. Before we begin, I would just like to please invite everybody to sign the consent form that was sent around with your invitation. Your participation in this webinar may be used in research. It is anonymous, but it may be used in research. And so I have asked if the Eracy team would please be very kind and provide the link to the consent form in the chat box. But also, if you're coming to us from a computer screen, you can click on the QR code and head straight to that. We can also provide that to you later as well. So we conducted the Families in Focus study, as mentioned, across 2 days in Children's Week at the Children's Hospital. We were conducting it right on the balcony out the front of the hospital there. It was a really beautiful day, and I'm absolutely delighted to be able to talk to you about what we got up to across those 2 days. I'd also like to pay my own respects to the traditional custodians of the lands. I'm here on the lands of the Yagara and Turrbal people. This has always been a site of learning and storytelling, and I'd like to bring those traditions with us today as we hear about the stories of families. I'd also like to acknowledge that in this space, we will be talking about the stories of lived experience. This can be something that can be quite difficult for some people. So I'd just like to invite everybody to please be aware of your own response, to listen and take care of your needs first. If necessary, support yourself and others around you and take a break. The beauty of these online webinars is that we can step away from the screen if necessary. And please access further resources or professional help if the need does arise. A very brief outline, we're going to be looking at a background to the study. I will be, and Jasnique will be doing that. I'll be looking at the activity itself and describing the 6 different interactive activities that we did across the event. And then we'll be hearing from participants' own lived experience of the event. We'll be having a look at the findings. What do the families tell us? And then towards the end of the webinar today, we'd really like to hear from you. We'd love to hear your feedback, and we've got some question prompts for you then. But I'd like to hand it over to Jasnique now to tell us a little bit about the background.
Thanks, Letitia. So welcome everybody, and thank you for this opportunity, Eracy, and I'd just like to acknowledge the amount of work that's gone into this webinar and also into the project itself from all the teams that have been involved. So let's start by thinking about how we got to this point. How did we decide to do this project? Well, it came from my PhD work where we were engaging with families of children with Down syndrome, and we were actually talking to them about sleep. But what was very apparent was that families caring for children with disability have many unmet needs. Some are simple, some are profoundly complex. And when we did these interviews and chatted to families, we realized that there was way more than just thinking about sleep, which was obviously the original focus of my work. And really, we could kind of find that there were 2 big things that we realized. One is that we don't know what the best way is to talk to children, siblings, caregivers to find out their needs. It's very hard to capture those people and very hard to know how to engage, particularly children and siblings in that kind of discussion. And then we were also kind of like, well, we actually don't know how to address the needs of families, and how do we do that to make sure we can identify the right solutions? So rather than us dictating what we think should be a solution, how do we get the information and engage with families in a way that means that we can actually provide solutions that are actually family focused. So the aim of this was to understand the key educational, health and social support experiences, needs and research priorities of children with disability and their families. So moving forward, we first of all did, as we always do with research, we looked through the literature. We looked at what was known about barriers, enablers, and opportunities for those caring for a child with a disability. And we wanted to find ideas for what appropriate target support might look like. So what have people already done? What have they already looked at? And as often is the case, the literature just gave us more questions, but also really focused us into thinking about, well, what might help the most, and what is not being captured. And, you know, what we found was that there was very little about other family members and about child perspectives in particular. We also found that fathers were underrepresented in the literature, and really we were kind of keen to try and see if there was a unique, different way in which we could engage everyone within a family of a child with disability. So then came the question, well, how do we do this? How do we talk to children and family who, you know, they're already busy, they're coming to lots of medical appointments, they don't have the time necessarily to engage in traditional research methods as much as they might like to. Life is busy, life is chaotic. We also know that many of these of the families that we're talking about have limited access to resources. Getting transport to come up to research appointments on top of your own appointments, you know, the time caring for their children, caring for other children, and then, you know, thinking about the actual way in which we engage with children, you know, what makes interesting, engaging research for children. And the question we came up with was, you know, how can we develop techniques that are suitable for young children, but also accessible and friendly for children with various different conditions. And we wanted the chance for children to be busy and having fun and doing activities, but also then that allows parents to actually engage in a unique and different way. And so really that's what we set out to try and do. And as I mentioned already, this brought together some incredible partnerships, which I was really grateful to everyone who collaborated with us on this. And you can see there, this was run through the Queensland Children's Hospital, the Queensland Brain Institute, the Life Course Centre, of course, my role at Child Health Research Centre, and support from various organisations, including ERACI, Child Unlimited, Children's Health Hospital Foundation, and then we had support from Juice TV, Starlight, and all sorts of people from the community. So we were really grateful for the amount of support that we got for this event.
Thank you, Jazz. So bringing together all of these different groups of people, we were able to create an interactive event that comprised 6 unique research activities. Prior to organising this, we consulted with stakeholders and community members during the development phase in order to identify the best time for the event and where we could do this that would help access the most amount of families. And we've also consulted stakeholders and community members during our analysis in order to sense check our findings. We collaborated with some young mentees through the Child Unlimited program with lived experience, and these young people were interested in research and advocacy, and so they helped us develop some of the resources as well. And it was really important that this work also aligns with the early years strategy, particularly the 5 key principles of the strategy, and within priority area 1, that children and families' perspectives are embedded into policy and practice outcomes and actions. So the very first activity that we asked for participants to engage in, we entitled The Nest, and we, as Jazz had mentioned, we'd been to the research to have a look at what was already out there about children and families' experiences. And what we did was compiled all of the research that we'd found and basically mapped it onto the 6 domains within ERACI's Wellbeing Wheel, The Nest. And so we wanted to be able to show families what we'd already found within the research, within the domain of healthy, participating, identity and culture, and so on. We presented these findings in a series of 6 posters that we had on display around the space, and we asked families to go through and read those posters. You can see that each one of those posters, we presented it as, what does the research say about the systems and structures for families, for carers, for children with disability and their siblings within the domain of healthy? And then we had the domain of material basics, valued, loved and safe, identity and culture, learning and participating. And it was important not only that families could see what we did find, but also what was missing within those areas as well. At the end of that, we asked families to consider what's missing inside their nest. what do they need for their child to thrive? What areas of research would they like to see prioritised? And we asked families to write this information on post-it notes and stick it on the board. And so you can see there that we had the board just overflowing with information from families about what they needed inside their nest for them to thrive. The second activity was primarily focused on children and young people. We had engaged a really wonderful artist who had experience working with children and young people with disability who are artists themselves. And she was able to engage children with the prompt to draw about their ideal school or hospital. So children, many of them drew their response, and others listed ideas about what they would want in their hospital. We actually found that this activity was a fantastic opportunity for our researchers to also interview parents. Quite often it's difficult to be able to have a talking one-on-one interview with parents at the very best of times. And so being able to speak to parents when their child is engaged in a fun and interactive and enjoyable activity meant that parents could relax and have a lovely conversation with one of our researchers. The third activity was focused on children and young people's experiences of socialising. Sorry about this. We'd had one of our young mentees write an excerpt about his experiences of socialising and what socialising meant for him. And then we also asked participants to watch a video with some young people talking about their experiences as well. Then we prompt people who walked through to either write their experiences about socialising in a shared notebook, to record their experiences on a voice recorder, or to click on a QR code and text their experiences through. The fourth activity was focused on sleep. Again, this one was very interactive. We asked parents to look at a video that had data poetry that one of our colleagues, Dr. Emma Cook, had written and animated, and they watched this video. There was also another beautiful poem written by one of our youth mentees about her experiences and the importance of sleep for her. We asked parents to then record their thoughts on a post-it note and post it up as well. But this activity also was one of the very first times that we've been able to engage children in talking to us about their experiences of sleep. And what we did was ask them a series of yes/no questions. And children could respond in a multitude of ways. They could respond by throwing a yes or no dice, by hitting one of those yes or no buttons, the horrible ones that the naughty uncle sends to your children at Christmas time. Or they could shout yes or no. They could do all sorts of ways of engaging. And this activity was so important because there were some children who came through who had found it very difficult to engage with people that they didn't know. And we had one particular carer say that she wished that this kind of approach could be taken with her child at their school because they were quite disengaged. The fifth activity was focused on education. We asked parents to write on our beautiful paper mache wall one barrier that they could see to their child's education, and then to think about what would help make a brighter educational future for their child, and to write that on the rainbow. The final activity, we borrowed a series of questions from the Nest's Wellbeing Framework question bank. And we printed these out and put them on a magnetic whiteboard. We then selected a bank of possible response options and asked families to slot in the responses to the questions on the whiteboard. And we had space for families to write their responses to these questions if none of our responses were suitable. We had a very similar activity for children where they could choose emojis as well, and our researchers helped facilitate those with children. So those were the 6 activities, and I'll hand it over to Jazz now to talk about how participants felt about the actual event on the days.
Thanks, Letitia. So I'm going to share two sort of experiences. One is from one of the mentees from the Child Unlimited program, and this was a really fulfilling experience for all of us to have these amazing young people involved in our research. So this is from one of our mentees, Darcy. It was really great working with other people who had similar experiences and a tough childhood to me, knowing how long and difficult it can be to get help in a timely manner through the public system. I was interested to see what I could do to help improve the services that we offer to those in hospital. I hope through this team and research, what we've started could hopefully go a long way in helping out young kids and their families who are tackling the public health system for the first time. I think you'll all agree that, it's really great to get that kind of input from individuals with lived experience who've been through the system all through their childhood. And I'd like to ask one of our parents who's very kindly agreed to come and give her thoughts on her experience of participating in this event. And so I'd like to welcome Summer onto the stage. So Summer is mother to a beautiful young boy with complex disability called Archer. Summer, I'd like to welcome you and first of all ask you about your thoughts when you first heard about this event, the Families in Focus event, and what you thought about this concept.
Well, thank you for having me. Yeah, it was a really good idea is the first thing I thought. As you mentioned, like for families like ours with complex medical conditions, we are just under the pump and we're overwhelmed constantly. So it's very hard to find the time to complete questionnaires. To us, it's just another email in our inbox that we have to try and address at some point with all the other paperwork we need to fill. So this was a great idea. One, it was at the hospital. As you know, that day I just happened to have an appointment there. So that was great timing for me as well. And that's really the time we really can get to the hospital to pass on that kind of feedback. So it was a really good introduction for it.
Thank you. And when you were going through the stations and, going through the different activities that you saw, can you share with us a little bit about how you felt and was it a positive experience? Did it bring up memories for you? What can you share with us?
Well, firstly, as you've both touched on earlier, a really great opportunity that came about was the fact that Archer was able to be engaged somewhere else. It's kind of very hard to be able to have a chat with another adult when you have a child around. So it was really nice to take a look around. I guess a lot of times when we're at appointments, we don't get the opportunity to kind of share our frustrations or things we have going on. Again, we're normally waiting to get to another appointment. Some people don't feel confident talking in a one-on-one situation in sharing some of their frustrations or concerns. I'm one of those people. It's not something I like to do. I probably write it down and share. So it's actually really nice for me to stop and take a step back and really think about what are these barriers that are stopping us from living our best life or Archer's best life? Also, what are some of the things that I haven't really thought about how far we've actually come from where we started our journey, Archer's 6.5. So I actually found a lot more positive experiences actually came out of there than what I had negative, which I'm very lucky for. But yeah, stopping and actually thinking, is this something that we can actually do? Because our families, we just live with the fact that this is our life now. Like, we don't expect that there's anything that can be done to make our life easier. So the fact that the conversation was opened up and we could share, and also seeing a lot of what the other parents wrote, knowing that everyone's kind of in the same boat. It's not just us. It's kind of spread across everybody. So it was quite eye-opening for us as well.
That's really great. Thank you for sharing that. And I'd just like to end by asking you if there's anything else that you'd like to add about your experience of participating in this event, and we'll come back to you at the end again, but just if there's anything you'd like to share at this stage before we go on to the findings.
With the things that I was going around to look at, one thing that was a key focus that I was looking at was in terms of the education and for medically complex children or those with disabilities entering daycare and the school years. It's a really difficult system to navigate. I was quite lucky that some families before me, there had been some resources in place that had been created by the hospital and by them. But coming into the school was a total new area, and pretty much everybody had a similar feedback I noticed on the doors is the resource of how do we tackle entering the school system and the education, and how do we take away the fear from a lot of the schools and the daycares and those facilities of a child with special needs or disabilities. It's something we encountered a lot entering daycare. We really had to fight to get him a spot. However, my experience going into school, and one of the things I was sharing most while I was there with the team, is that I've got a school who is absolutely incredible, but I had engaged them a year before because I was so scared they weren't going to be ready. I had them meet Archer many times. We went through a lot of things. So I think maybe putting together some type of resource in preparing to enter the education system, and knowing that the earlier you start out as a family, the more confident that the school feels, the parents and the child feels in entering that.
That's great. Thank you. Some of that leads really nicely onto our findings. So I'm going to hand back over to Letitia, and we'll come back to you towards the end.
Thanks so much, Summer. Thanks, Jasnik. Okay, so across these 2 days, we collected so much information from families. We had more than 40 families walk through this event. And to put that into perspective, as researchers, if we're trying to engage in in-depth one-on-one interviews with families with lived experience, this can take us well over a year to get this much information from families. So, and in addition to that, it may be much more difficult to even be able to talk to certain families who, as we mentioned earlier, don't always have access to these spaces or don't have time to sit down and have a Zoom meeting or a conversation on the phone. So this was something that was really special. So across these 2 days, and from these 40 families in person and more than 10 families who participated in our online companion event, we had a range of data and an abundance of information. And what we've done with that is similar to the research that we were looking at. We mapped the findings onto the 6 areas of ERACE's Wellbeing Wheel the Nest. And that's so that we could see what families were saying within each of these domains. So within the domain of healthy, we found that children in particular really appreciated the opportunity to engage in play spaces in the hospital. They loved having toys in the waiting rooms, and having the starlight room and sensory play experiences were really important for them. Families who had access to connected care really talked about how helpful that was in their experience of navigating hospital systems. And many of them described having trusted health professionals in their corner. However, we did also note that many families talked about the difficulties in accessing connected care. And for those who weren't able to access it, this had negative implications for their experiences. Some families talked about the pressure to remember and relay complex medical information. For example, one parent had said that we didn't get a connected care nurse whenever we were going to a different department. I was having to explain all of the other conditions. I carried a lot of fear around if I'm missing something. Having to constantly relay this information creates an enormous burden. And suggest that parents need to advocate for their child. Parents talked about the stress of long wait times for admission, medicines, appointments, and diagnoses. We heard from young people as well, and from siblings who said that sometimes they get a bit bored or worried, a bit nervous and sad when they're visiting their siblings in hospital. Within the domain of identity and culture, we spoke to many families who did feel contented, supported, cared for, and included within their community. And we found, talking to parents, that as some of the experience showed, that schools can be really important sites for having positive experiences that help. One parent in particular mentioned that my child is Indigenous. His new school that he's going to is extremely amazing. He's going there next year. The school is full of culture and it's diverse. Inclusion there is huge. It's massive. However, not all families had the same positive experiences with schools. Parents and children alike reported feeling judged within their communities, and some children faced stigmatization as well at the school level. In hospitals, families were concerned that, cultural insensitivity still exists, And even though the functionality of, say, Google Translate can help, one family mentioned that the translator doesn't explain the same sort of emotions, and being able to impart emotion was really, really important. Within the domain of valued, loved, and safe, many children reported having teachers that they bonded well with, and those who had that experience talked about it being very important for them and how they manage their condition. Within the hospital and care setting, many children talked about having very positive experiences with the nurses and the healthcare providers. And parents indicated that when they were able to regularly visit service and healthcare providers, that this helped build trust for their children. So, for example, going to dentists and hairdressers on the same one and having this continuity of care again really helped. Yet within the community, many children faced bullying, and this can have some very serious consequences for children's mental health. One parent indicated that because their child has got a particular disability, he gets bullied to the point that he comes home crying. And at one point he wanted to go and end it all. Even her daughters were also getting bullied and at the same time. And so the stigma still exists for some children and families within the community, and this can be a barrier to parents' help seeking. Importantly, what we also found is that the necessity to stay with a child while in hospital means that parents are unable to leave for either self-care or to spend time with other family members and friends, and this can impact on their relationships with other family members and also with themselves as well. Within the domain of participating, as we mentioned, we spoke to kids about this experience of being social. And when children experience one-on-one, safe, supportive friendships, this really helps children feel connected and included. They love, children talk about loving playing with friends, making new friends, having friends in the hospital, having friends at school. Building Lego in the hospital is a really important way that children connect. And the hospital can provide opportunities for children to experience autonomy and to make their own choices. Yet for many children, group social situations can be challenging. We heard from some parents and children alike who reported being nervous about making new friends, how their disability might show up for them in social situations, and how other people might respond to that. And that can be a barrier to them making friends. So one parent said he's afraid of going over to friends' places for sleepovers. He's worried he's going to have a meltdown. He's worried he'll hurt his friends. So he's closed himself off, and now it's just him and us. Parents also often across the 2 days talked about the effects of social isolation when children are in hospital for long periods of time, and this was a big concern for them. We spoke to parents about a range of different things, and including their experiences with finances, housing and accommodation. And some families were okay and were managing. And for those who could access Ronald McDonald House, this was an enormous help. We had one family indicate to us that at the moment they're living in a tent. And so having access to the Ronald McDonald House made a huge difference for them to be able to access the medical care that they needed for their child at the moment. Things are pretty tough for families at the moment at the best of times. So these services are absolutely crucial for their children's health and well-being. Yet overwhelmingly, almost all the families we spoke to talked about the financial implications on their lives of where they're at with caring for a child with disability. And these financial costs are exacerbated by the cost of travel. Many families come very long distances to get to the children's hospital. Parking is exorbitant, the cost of medications, and also for some people it's very difficult to sustain employment when you're caring for a child as well. And accommodation options aren't always available, or they're not always enough for entire families. So some families are separated during treatments, which is difficult. When it comes to learning, parents really valued the opportunities provided to their children, and education is a really, really important part of the conversations that we had across the 2 days. The ECDP programs are really valued by families. Parents choose a range of different educational options for their child depending on what suits them, their lifestyle, their educational needs, what kinds of schools are available, the supports they get. So some children were attending special schools that were supportive. Some had chosen to send their children to mainstream, and some were homeschooling their children. Many of these choices were in response to either a lack of opportunities in a different educational option, but not all. And when learning experiences are supportive, these experiences are life-changing for children. Some parents also reported really valuing when allied health integration sits within school sites. There was one really notable, really positive experience here where this one parent in particular talked about having a rough start because the early childhood education and care setting that they were going to send their children to had never looked after anyone with Down syndrome before. But the kindy teacher now knows this child really well and is advocating for her to go to school. And the parent here wished that there were more places that would have an open mind about children with a disability and to provide these opportunities for kids. Parents were primarily concerned about the effects of lost education while their child is in hospital. And we've talked about the lack of inclusion in the education system, and that not all schools are set up to provide these services to children and to provide the care and the education that they need. I'd like to hand over to Jazz now that we've seen all of the findings to basically talk about what we need to know next.
So thanks, Letitia. And I think, you can all see that there was some really rich data that we gained, and really great knowledge from families who are really open about their feelings. But we do need to know more. Whilst we did engage some families from Aboriginal and Torres Strait Islander groups, we still need more. Similarly, culturally and linguistically diverse families. We did capture some that were from regional, rural and remote locations, just because this was based at the hospital, and there were some families who were actually staying locally because they come from rural and remote areas, and this gave them the opportunity to engage. But clearly we still need to know more about these groups as well. And one of the things that we've sort of come to is, how do we sustain engagement with families who find it very difficult to connect to the healthcare system, the education system, and every other system that they're involved in. So I think certainly, although we've gained some very important findings, we still have more to learn. And in a second, I'm going to move over to asking you all to participate with some feedback from what we've presented. But before I do that, I would really like to invite Summer back on, just to really give us her perspectives on these findings that we've presented today. So Summer, I just wanted to ask you if you could finish off our presentation by telling us about how you felt when you heard these findings from Families in Focus, and whether you felt they resonated with you and sort of were in line with your own feelings.
Yeah, I think there was 3 key ones I kind of saw that was just spoke about, which I think would cross along most families, and that's the education, which we'd already touched on briefly before, and thinking that I don't know if it's the education places that actually need more education on taking on children with that don't have mental disabilities, that are able to be integrated into the school system not be so scared of it. The cost. So we live 2 hours away from the hospital, and so like I have an appointment next month, and it's going to take me a 4-hour round trip for a 15-minute quick catch up. We do that quite regularly. We're down there tonight for a sleep study. So after this, I'm heading down to picking up the son and heading down. Costs a lot in petrol going to and from. It's wear and tear on our car. I would love to share it with my partner, and this was another thing that was brought up when you mentioned about fathers. No offense, and not generalizing, but like my partner, he's very scared of not remembering the information or asking the right questions. He obviously makes more money than I do, so it makes sense for me to go down and do these times. And in terms of the support around employment, I am very lucky to work at a place who has known me even before my son was born, so I've been through the journey and very accommodating. However, I can't get Archer into any after school care facilities or before school care. So when it comes to school holidays, I have to use my annual leave. And I do a week annual leave so I can do some play with him, and then I try and work home. And of course, he wants to go playing and I can't do too much because I'm working while he has to sit here. So those things that came through were definitely something I think that's felt by most people. Yeah.
Thank you. And finally, because I'm going to open this up to everyone else, what I'm going to give you first go at saying what you think the next steps should be, and how people who are in this audience today can help, and what you think we should be doing from here. No pressure.
Oh, no. Okay. I'd like to think it's a nice, simple answer from the family member. Obviously, it's probably not so much. There's a lot more that goes on behind the scenes to make these things happen. But I've done a lot of feedback things since Archer's been born, almost 7 years ago. And I think it's about following up with the action. We do a lot of feedback, but it's not very often we actually see what the outcome is from that, or if something has come out, be it one or two things. And obviously a lot of the things that are focused on is obviously the majority, because that's how it works. We focus on the majority thing, but the minority is also really important too. The smaller things. We're in a minority in terms of Archer's medical condition, and so we don't get too much because we're too small a group of people for it to be a bigger matter. So yeah, I think it's focusing on the minority as well as the majority.
Absolutely, I think that's really really nice way to end. So thank you so much, Summer. I really appreciate that, and we're going to move now to some feedback and some engagement with you, which obviously I'm aware that this is through Q&A, but we do have some questions that we'd like to ask you. I'm going to hand over to Letitia to run the Mentimeter survey that you can all participate in, and then please feel free to add to the Q&A, which I'll be monitoring while you're doing that as well.
So if everybody wants to go to either click the QR code, or they can go into a web browser and type in menti.com, and then you can use the code 52972180. And there are spaces in there for you to answer the questions that we've posed. I might stop sharing my screen and jump onto the Menti screen now, but okay. So the first question is, how do we ensure that systems are truly inclusive and supportive of diversity? Sorry, I think I've got the wrong one up. Sorry, bear with me one moment.
I've got it, Letitia, I can bring it up.
Oh, that'd be great. Thanks, Jazz. Wonderful. Thank you.
So you can see here the responses that are coming through, which is great. There's some very similar responses coming through there, which is great to see. We'll just give you another 30 seconds or so, and then we'll move on to the next question. Okay. Now, can I get it to the next question? That's the question.
The other question there is, what stood out for you and why, and how can we address the feedback gathered during the Families in Focus activity in policy practice and future research?
I think you might need to move it to the next question on the Mentimeter, Letitia.
Yeah, okay. That worked for you, Jazz?
Yep.
Okay, great.
I think there's a few people asking for the code. We can put a link in, and then you can put the ID code that was there.
Okay.
So the ID code for the Mentimeter, if you missed it, was 52972180.
That's great. We've got some people saying that I'm very interested in the methods and how successful it was to engage parents and children creatively. Yes, we do plan on publishing these methods so that they can be, so that other people can draw on this experience as well.
Yeah, that's great.
Yeah. Making the project fun for kids to participate in. The creative and child-centered way we used play to capture the information. Thank you. Someone has mentioned that's a wonderful creative way to capture information.
Yeah, definitely would be great to get some feedback from the children as well. I agree.
Yeah,
Okay.
I yes, absolutely.
Right, we might do again another 30 seconds, and then we'll move on to the next question. That's great. Okay, Letitia, the next one.
The next one. Yep.
And this is really where we want your help. How can we address the feedback in policy practice and future research? Questions get harder, clearly.
Oh. Need to see the photos and videos. I think one thing that comes out of speaking to families is that particularly for us in research, we often see numbers and making sure that families stay at the heart of the research is really important. And I think that links nicely to seeing the photos and videos, that we need to make sure that we're keeping people at the heart of everything that we do. support for families to educate their communities around how they can be best supported, their needs, but also in fostering compassion in settings like schools and sporting groups. Yeah. In future, policymakers should attend events like this.
We definitely tried. We'll keep trying. Yeah, we're definitely planning to publish the work. So yeah, we will definitely be doing that. TikTok. I like that one. Okay, we might give you another sort of 30 seconds or so for any final responses. Okay. Still going, it's great. Okay.
Yeah. All right. Did you want me to jump back to the...
Sure.
Okay.
Yeah. So while Letitia's getting the presentation back up, I'd just like to take a moment to invite you to write any additional questions that you may have. We do have a few more prompts here. We really want to use the last 10 minutes or so of this webinar to engage you in conversation. If there's something that you really feel we should work on, or what stood out for you from what we've presented, some of this you've already responded to in our questions. But really, you know, how we can ensure that the systems are truly inclusive and supportive of diversity. And so I'll be really grateful for any questions that are coming through. I did see one that came through earlier about engaging families of young disabled adults, and certainly I've had some discussions initially with some of the adult colleagues that we work with at the Mater, who have been interested in our work and reached out to us after hearing about our event. So certainly we are aware that engaging with not only children but families across the span of life is really key to ensuring that we can have impact. Yeah, a comment there about needing to try and get more young people's voices. I'd be interested to know if people have any thoughts on how we can engage more young people. You know, obviously we're using different methods. We're trying to do these things. We've talked within the hospital about ways in which we could run, for example, mini versions of this, or whether you think this would be better to take out to the community, take them to rural and remote areas. If anyone has any thoughts on that, it'd be really great to hear from you in the Q&A or in the chat.
Go, Jazz.
There's a question about whether we've published the work. It's on its way. It's not there yet. We hope to have this work published by the end of the year is the goal, to get the first papers out. So yes, we're hoping that will happen soon.
We've also had somebody else ask, what was our biggest insight, either pleasant or unpleasant? Did you want to start that? Did you want to respond to that one?
Sure. I think the biggest insights for me were that as a physician in the hospital, we really just scratched the surface in what's going on for these for families, and I think that was a really striking finding, and just kind of makes you remember that. So I think it's a very good exercise in that respect. And I think some of the comments that we heard, some of the things that we saw written down, just really make you realize that we need to do better, and we need to do more, and we need to work collaboratively with everyone and anyone that we can, to try and improve things for families who are you know, facing multiple challenges in one go. So I think for me that would certainly be what I found most insightful. And in terms of the pleasant, just the opportunity to chat to people and to see the engagement we got was incredible from families. And we've had some really positive feedback from families after the event as well. So I think that's been really nice to see.
Yeah, I think what stood out for me from the day was the imperative for families to individually advocate for their child. And it really got me questioning what that means for individual families. Families who are more well-resourced may be able to access better health, more regular health treatments and those sorts of things. And what are the outcomes for families who are not able to access these resources and that are constantly having to advocate and fight and be a warrior for their own children? It shouldn't be up to the individual to continuously do this. This is something that at a systems level, we absolutely need to be addressing and to change these experiences and outcomes for families at the systems level. And in terms of pleasant, very similar to Jessenique's experience, this opportunity to speak to families was, I guess this terminology gets used all the time, but it was an incredibly humbling and moving 2 days. And it's always a humbling experience to hear to talk to people and have them share some very intimate moments with you. And these were very humbling experiences. And just the strength with which people, against all of the things that they're fighting for, are still managing to do such extraordinary work within their own families is absolutely worthy of acknowledgement. So that was something very beautiful and really cool.
There's a question there about whether we'd change anything about the engagement process if we were going to run an event like this again. That's a really good question. And I think if we were to change one thing, it would probably be to try and have greater dissemination of the fact that the event's happening and try and reach more families. And I think we tried to run an online event alongside this, and I think that was less successful. And I think that's a really important learning point for us about how we engage ongoing with families, and just the way in which we translate things that we're doing in person to make them accessible for families that perhaps can't get to an event needs to be a bit different and needs to be a bit more stimulating and a way in which we can engage. And we're thinking about that now as to how we can make that a little bit more engaging online. And someone put TikTok there in the comments and the questions, and that's maybe not a joke, having things that actually can reach out in a different way. So I think that's what I would change. I would try and make this more well known. It was a first go for us. We were a bit nervous about how we'd manage, and I think we would do more if we could. And I see there's a question about whether speeches were involved. We tried to reach out to as many people within different allied health sectors within the hospital as we could. What was tricky is, I guess, we were doing it at times when we wanted to capture families, which is often when clinicians and allied health are busy. So it was a bit challenging. We did have quite a few different people from various streams of allied health that were involved on the day, ranging from nurses through to scientists from the lab through to clinicians like myself, and then researchers like Letitia and sociology background. We had a whole ream of different people actually that were involved on the day. So it was certainly very labour intensive as well. But as Letitia said, we got so much information that would normally take us like a year to collect that kind of data.
Yeah. I think Senator Jordan Steele John does a great job of engaging people over social media. Yeah. So I think, yes, I'm a researcher, and social media engagement is definitely not necessarily my forte. I think in terms of what we'd change, it would be the online presence. I'd love to engage with somebody with those sorts of skills to help facilitate this within the online sphere as well.
Yeah. And there's a question there about whether we can replicate this across Australian hospitals. That's certainly a thought process, and I guess that kind of leads us on to our sort of final kind of slides, which really are about next steps. And we do have some things that we've been doing already. We have been liaising with the hospital where I work, and certainly we've been involved in some of the discussions about the strategic plan and how we can inform that for families of children with disabilities. We are writing up our papers and our publications, and that will obviously be key to us being able to disseminate these findings further, and obviously pulling together reports that can have greater impact as well. We're talking about the potential to roll out at other locations and other contexts, and involving other people. I think, as always, that takes funding, and that takes manpower, and those are the things that we're working on at the moment to try and make this possible long term, and to gather more information. We're really keen to hear from anybody who has thoughts or would like to be involved in things that we're progressing, and Letitia and I have included our email addresses on the slides, so that if anyone is looking at these and would like to be involved, we'd love to hear from you. Or even if you'd just like to know more about the findings in a bit more detail, please feel free to reach out to us. And I think we have to end another survey to ask you to do for us. If you feel you wish to give us further information, if you think you would like to provide us with some more detailed feedback, you are very welcome to fill this in. This is obviously optional. It's not something that you have to do, but something that we would very much appreciate it if you do have something burning that you'd like to share with us. And on that note, before I hand over to end the webinar, I'd just like to particularly thank Summer and Eracy for their time today in helping us put this together. And we really appreciate all the feedback that's coming through, and we will definitely take some time to go through everybody's comments and reply to any questions that we can as well.
Thank you so much, Jazz, Letitia and Summer. That was such a positive presentation, and obviously a really positive activity and research project that you undertook. And I think it would have been such a relief for so many families to be able to provide that feedback in such an easy way. And as you said, Summer, not just yet another form that you have to fill out. So really impressive, and I hopefully Eracy can continue to work with you to help support further work in this area. So that brings us to the end of today's webinar. Thank you again for sharing your time and expertise, and again to you, Summer, for sharing your personal experiences. And thank you to our audience for joining us today. A couple of people were asking earlier about recordings of the sessions. Yes, it will be available in the coming week on Eracy's website and via our YouTube channel, and we'll share links in the Eracy newsletter as well. If you're not already, you can subscribe to Eracy's newsletter to be kept up to date with our news, events and future webinars, and the link should be now in the chat box, or hop onto our website and follow the links there. Thank you again. Really impressive work, and we'll now bring this event to a close, and we look forward to seeing you all at our next webinar.
Great. Thank you so much.